We are groups of students from Universidad Nacional Mayor de San Marcos going into the Faculty of Medicine San Fernando. In this occasion, we are going to present a project about pharmaceutical science.
The purpose of this review is to describe the global contributions of pharmacy professionals during the COVID-19 situation and prospect of the pharmaceutical care services in the post-pandemic period. Contributions of community pharmacies in COVID-19. Community pharmacies are healthcare providers who play a critical role in responding to symptoms. Community pharmacies are making an essential contribution to public health, where patients face obstacles such as acute shortage of primary care providers without adequate facilities. Pharmaceutical care services during COVID-19 were divided into two categories. One was pandemic prevention and control, and the other was the provision of pharmaceutical services to patients. Community pharmacy management teams supported primary care services by providing an adequate supply of medicines and preventive products.
Contribution of hospital pharmacies in COVID-19. Today, coronavirus pandemic has increased the responsibility of hospital pharmacies to care for coronavirus patients in hospital and manage the pandemic emergency. In addition, they are helping to determine the stability and efficacy of new antiviral drugs, supporting pharmaceutical care service, and participating in coronavirus medical engagement groups to facilitate the fight against pandemic disease by developing strategies to address drug shortage, ensuring safe transition of care through medication reconciliation. Due to the restrictive availability of personal protective equipment, in most hospitals, the existence of pharmaceutical service provided by hospital pharmacies often make them vulnerable to infection on a regular basis. The most prominent activities of hospital pharmacies in different countries are follows: United States of America, China, Canada, Australia, Saudi Arabia, Qatar, South Africa, Nigeria, Lebanon, Spain, miscellaneous. Next.
Clinical pharmacies in COVID-19. Clinical pharmacies are specially trained licensed practitioners who provide all types of direct patient care settings by utilizing their in-depth knowledge of medications. Amidst the heat of COVID-19 pandemic, they provide a wide range of patient services, including emphasizing dosage, multi-drug therapy reviews, providing precise provision of patients' assistance, monitoring of level use of the drug, medication efficacy, or adverse drug reaction, attending clinical rounds, preparing discharge, and proper counseling of patients. Okay, contributions of industrial pharmacies and pharmaceutical companies in COVID-19. The outstanding achievement of industrial pharmacists are the prime reason behind the smooth services provided by other healthcare professionals. In the initial COVID-19 period, the bulk production of drugs was hampered by drug shortage events. To meet this increased demand for medicines and medical devices, the industrial pharmacies had to work around the clock to scale up the manufacturing process that ensures smooth supply of proper medicines, surgical items, disinfectants, immune modulators, and other related medicines. Global recognition of pharmacies in COVID-19. The role of pharmacy professionals vary across countries and their expertise is underestimated in some situations. Asian pharmacies of Chinese descent faced an additional burden of harassment and anti-Asian racism in many countries like the USA, the UK, and France as a result of the COVID-19 pandemic. The government of New Zealand and Northern Ireland has acknowledged pharmacies by providing extra remuneration amidst COVID-19.
Conclusion. The COVID-19 pandemic not only posed a major challenge and brought the healthcare system, the method of the delivery of pharmaceutical cards has completely changed, and pharmacies has a great responsibility in mitigating and combating this pandemic. In many countries there now occupy more involvement position in health service, underscoring the importance of pharmacy.
Now we have the glossary. Number 1, admixture. 2 or more drugs blended or mixed to create a desired substance or solution. Number 2, adverse reaction, an undesired of negative response to a medication or drug interaction. Number 3, agonist, a drug that triggers a receptor to produce a psychological response. Number 4, bioavailability, the rate that a drug is made available to the target site of physiological activity. Bioequivalence, the rate that drug is made available to the target site of physiological activity. Number 6, biologic, a therapeutic drug or vaccine made from living organisms. Number 7, clinical trials, a multi-phase process from drug discovery through post-marketing. Number 8, closed formulary, drugs not in approved list. They require prior authorization or may not be covered by the insurer. Number 9, concerns, the percentage of cost of covered healthcare services you pay 20%, for example, after you have paid your deductible. Number 10, displacement occurs when a fluid volume appears greater because a non-fluid substance is introduced. Number 11, diuretic, tending to increase the excretion of urine. Number 12, dopamine, a neurotransmitter essential to the normal functioning of the central nervous system. Electrolytes. These electrolytes are required for various bodily processes, including proper nerve and muscle function, maintaining acid-base balance, and keeping you hydrated. Elixir, a sweetening liquid usually containing alcohol that is used in medication either for its medicinal ingredients or as flavoring. Emulsion, a mixture of two or more liquids that are normally not mixable with each other. Formulary, a list of prescription drugs covered by prescription drug plan or another insurance plan offering prescription drug benefits.
The neurotransmitter is essential to the normal functioning of the central nervous system. Number 18, generic drug, a medication not protected by patents described and marketing under its pharmaceutical of chemical name, usually by multiple manufacturers of the lowest end use costs. Generic non-proprietary, a drug name not protected by a trademark like aspirin usually describe the drug's chemical structure. 7. No, fine. F. Side effects, particulars are it is a type of healthily effective are filtered inert ingredients, filled or not drug ingredients in medical goods are inactive. Next. Infuse rate, total volume of IV necessary to deliver no drug within the time frames the prescriptions. 22. Laxative, normally prescribed for nose constipation. It is a substance that protects bowel movements. Lozenge, now better as cold drop, they seem to dissolve in the mouth to soothe and lubricate the throat. This product, what's a product is liability of marketing falsely or in misleading manner. Next.
25. Mechanisms of action. The method in which a drug produces an effect on the condition intended to treat. 26. Multi-source drugs. Any and all the generic drugs, including the innovator, which are competing against each other. 27. Narcotics. Drugs that induce various station narcotic adult instances. They are typically used to treat pain. 28. Oath of pharmacists. This oath is taken by pharmacy students upon graduation. By taking this oath, they voluntarily vow to dedicate themselves to a lifetime of service to others throughout the profession of pharmacy. Next. 29. Opiate. Drugs that are derived from opium typically used for pain management. 30. Placebo. Commonly referred to as sugar pill, a placebo contains no medicine, but a patient thinks it do it and result may occur because of this belief. Placebos are mostly used in clinical trials to experiment with groups of people in double-blind studies. 51. Sedative. Drugs that work on the central nervous system to help calm anxiety and stress. 32. Vaporizer. A medical device used for converting a medical liquid into a vapor for inhalation. Next. Thank you very much for attention.